Dear viewers, are you over 50? Do you often experience difficulty while urinating or pain in your lower abdomen? If that sounds familiar, this video is for you. I'm Rana, and today we're going to talk about what prostate cancer really is, what its signs and symptoms are, how it's diagnosed, and the key causes behind prostate enlargement. And finally, we'll explain which natural foods can help reduce the risk of prostate cancer and shrink and enlarge prostate naturally. Across the world, prostate cancer is the second most common cancer among men. In 2024, it is estimated that approximately 1.5 million men worldwide were diagnosed with prostate cancer, making it the most common cancer in men in 118 countries. In 2025, about 300,000 new cases are expected in the US alone, with nearly 35,000 deaths, according to the American Cancer Society and National Cancer Institute. Before we talk about prostate cancer, let's first understand the male reproductive system. The primary function of the male reproductive system is the production of male germ cells, sperm. The organs that produce sperm are called testicles in medical terms. Most male mammals, including humans, have two testicles. One testicle is often slightly smaller than the other, which is usually not a cause for concern. In addition to testosterone, the testicles produce sperm. A single testis produces roughly 1,500 sperm per second, which translates to about 100 million sperm per day. But sperm must mature before they can fertilize an egg. Many people confuse semen and sperm. Semen is the fluid expelled during ejaculation and contains sperm. By volume, sperm make up only about 5% of semen. The rest comes from accessory glands. During ejaculation, roughly 100 million sperm are released. And of those millions, only one sperm typically succeeds in fertilizing an egg. Now, let's move on to the main topic, prostate cancer. Prostate cancer develops in the prostate gland, which is located below the bladder and surrounds the urethra, the tube that carries urine out of the body. The exact cause of prostate cancer is still not fully known, but specialists have identified several risk factors, the most common being age. Men over 50 are at significantly higher risk, and the peak age for diagnosis is usually after 60. Men who already face urinary difficulties after 50 are even more prone to the disease. Family history and genetic factors can also increase an individual's risk. Common symptoms may include difficulty urinating or weak urine flow, frequent urination, especially at night, blood in urine, pain in the lower back, hips, or bones. In early stages, symptoms may be absent for years due to slow progression. Symptoms appear when the enlarged prostate presses the urinary tract. How is prostate cancer diagnosed? Prostate cancer is primarily detected through a few medical tests. PSA test, the prostate-specific antigen test. A digital rectal examination and several other diagnostic tests are also used. Transrectal ultrasound, commonly called TRUS, provides detailed imaging of the prostate. If suspicious areas are seen on imaging, doctors may recommend a biopsy. A biopsy confirms whether cancer is present, and if so, helps determine the type and aggressiveness of the cancer. Causes of prostate enlargement. The prostate is a gland that surrounds a small tube beneath the bladder. Normally, it's the size of a walnut, but when it grows larger, it can disrupt urine flow, causing discomfort and frequent need to urinate, especially at night. An enlarged prostate can also increase the risk of prostate cancer, medically known as benign prostatic hyperplasia, or BPH. The key factor behind prostate enlargement is a hormone called testosterone. Testosterone is anabolic, meaning it helps tissue growth, including muscles. With the help of a specific enzyme, testosterone converts into dihydrotestosterone, or DHT, a more potent form. DHT plays a major role in enlarging the prostate. As men age, testosterone levels drop, but the enzyme's activity increases, producing more DHT, which leads to prostate enlargement. Many medications on the market claim to shrink the prostate by around 23%, but they often come with serious side effects, like reduced libido, an increased risk of prostate cancer, and other withdrawal issues once the drug is stopped. So, how can you protect your prostate and reduce the risk of prostate cancer? Naturally. Is there a natural way to inhibit this enzyme? Yes. Lycopene, a carotenoid found abundantly in tomatoes, watermelon, carrots, and grapefruit, has been shown in studies to decrease prostate enlargement risk by 21% and also reduce inflammation with strong antioxidant properties. For highest lycopene absorption, cooking tomatoes with a bit of olive oil is recommended since lycopene is fat-soluble. Eating tomato-based dishes twice per week can provide great prostate support. Other helpful substances include zinc and a compound called Rectal. However, it's best to avoid dairy products like milk, as growth hormones in milk may worsen prostate enlargement and urinary symptoms. To prevent prostate cancer, eating a variety of colorful vegetables and fruits, especially tomatoes, which play an important role in prostate cancer prevention. Avoiding red meat and processed meats. Limiting consumption of sugary soft drinks and sodas. If prostate cancer is detected at an early stage, it can be treated, and cure is often possible. In other situations, treatment may not completely eradicate the disease, but doctors can often achieve control and remission. Radical prostatectomy, surgical removal of the prostate, is one major treatment option. Like other cancers, prostate cancer treatment can also include radiotherapy, hormone therapy, and chemotherapy, depending on the individual case. The World Health Organization reports that among cancers affecting men, lung cancer ranks first, prostate cancer ranks second, and colorectal cancer ranks third. The most effective way to reduce cancer mortality is vigilance, regular screening, early detection, and prompt treatment.